Hi everyone, sorry for our late entry. It looks like I might have had two separate links sent out, so I apologize for that. I'm going to email our guest speaker really quick just to, oh no, she is on this one, so that's perfect. Okay. So, yeah, perfect. Okay. So, hello everybody.
Good morning.
If you wouldn't mind just signing in the chat, just putting your name, and if you are new to these meetings, also put your name, agency, and email into the chat box. And we'll just give it one more minute just to be safe. All right. Welcome everyone. Thank you all for joining us today for our June Healthy Communities Coalition meeting. Before we get into the agenda, Sue would like to make a quick announcement. Oh, you're on mute, Sue.
Good morning, everybody. Sorry about that. For those of you that don't know me, I'm Sue Reed. I'm the Executive Director here at Healthy Communities. And this morning, I'm really excited to make the announcement that we've made the decision to add another full-time staff member, Jen Mann, who will be our enrollment specialist. She'll be processing a majority of the applicants that come in for healthcare coverage, but then she'll also be assisting Rose with some outreach activities as well. So Jen, would you like to go ahead and introduce yourself to the group?
Hey everybody, I'm excited to be here. I think we're really going to be able to do some great things. My name, like Sue said, is Jen Mann. I used to work at the Medicaid office. I have about 6 years of experience doing applications, mostly for HIP and Hoosier Health-wise, but some with disability cases also. So I think we're really going to be able to do some great things, get our numbers up and get people covered and really make an impact. So I'm looking forward to getting started.
Great. Thank you, Jen. We're so excited to have you as part of our team, and the expertise you bring is going to be invaluable. So thank you again for joining us.
Definitely, sure.
Awesome. All right, so we will jump right into introductions and sharing. I will call on each of you to just briefly introduce yourselves and share any quick announcements you'd like with the group. We do have a guest speaker after introductions and sharing. So try to keep your comments as brief as possible. And you're more than welcome to share any updates in the chat box as well. All right, so I will start us off. My name is Melina Rivera, and I am the Tobacco Program Coordinator for Healthy Communities of LaPorte County. First of all, I'm excited to announce that the Indiana Department of Health's Tobacco Prevention and Cessation Commission has awarded us funding for the 2021 to 2023 grant cycle to continue our tobacco control work here in LaPorte County. So we are very excited and happy about that. The new grant cycle starts in July, and we really want to hit the ground running and start making change. So we were able to start this coalition back up virtually as brand new staff and have had 5 successful meetings so far. And we thank all of you so much for your attendance and support over the past 5 months. This coalition has primarily been for 2 purposes, which are increasing access to health coverage and also for tobacco prevention and cessation. And lately we've been focused on just getting to know you all. We've been focused on education, professional development, And that will always be woven into our meetings, but we are at the point now where we want to start taking action, as we are all here because we have common interests and want to make LaPorte County healthier. And now that our new tobacco grant is starting next month, we really want to be more action oriented. And we believe the best way to do this is to break up this coalition into two coalitions. One would be for health coverage, and the other would be for tobacco prevention and cessation. So to give you a better idea, the Health Coverage Coalition will be focused on collaboration, education, policy updates, and information, as well as addressing needs, barriers, and challenges of the uninsured and underinsured populations, and also sharing ideas, resources, and events that pertain to healthcare coverage and access to care, and much more. And the Tobacco Coalition will be focused on a number of tobacco prevention and cessation topics with a health equity lens. And I have an extensive tobacco control work plan covering 11 different topics, such as youth prevention and empowerment, and Rose will speak more about that later, as well as smoke-free comprehensive air ordinances, tobacco-free environments, cessation, and much more. So we are really looking for passionate people who are committed to taking action and making change. So we all have different and valuable skill sets to bring to the table, and I'm excited to see what we can all accomplish together. So I will be sending out a survey soon to gauge which coalition you all would be more interested in joining. And you can also join both if that's what you would like. And I will let you know the results from that survey in our July meeting. And so that we can begin choosing the best times to meet in all of that. I also wanted to mention that I started facilitating monthly tobacco cessation classes at Grace Learning Center, and they're really focused on the Indiana Tobacco Quit Line. So if anyone else is interested in having a cessation presentation, class, or trainings on the Quit Line, I'd be more than happy to assist. And my final update is that our Summer Healthy Communities Coalition newsletter will be released on July 13th. And as a reminder, this is an opportunity for you all to share anything you'd like about your agency, services, events, and more. So please, if you're interested in submitting anything, send those submissions to me via email by June 29th. And now I will pass it over to Sue.
Great. Thank you, Melina. And also, I'm just going to add real quickly that whenever Melina does a presentation about tobacco and the quit line, she always integrates information about covering kids and families, because those individuals, families may need assistance with healthcare coverage as well. So you already met me again. Hello, I'm Sue. And I was hoping to report that we may be able to start with some in-person meetings for those who felt comfortable. However, the positivity rate is still fairly high in LaPorte County. We had a meeting the middle of May at the Star Center, and we made the decision not to have anybody from the outside yet come into our offices until we see a better decline in positivity. We'll probably be meeting again the middle to end of June to look at this. So hopefully I'll have an update. We'll still provide the coalition meetings via Zoom for those who prefer to meet that way, but for those that like to see in-person smiling faces, hopefully we'll be doing those again very soon. Also, I thought it'd be kind of interesting to share some data in terms of health coverage in our area that I received. 72,553 Hoosiers in our service area covered by the Indiana Health Coverage Marketplace provide outreach, education, and enrollment assistance, but we have 17,676 uninsured Hoosiers in our area, and 2,183 of them are children. In 2020 at Healthy Communities, despite all the hurdles that were thrown at all of our organizations due to COVID, we were still able to take in 237 applications. And I'm really proud to say that 202 of them were approved with a approval ratio of 89%. So that shows we are definitely targeting the right areas in our community, but we need more. And that's why we made the addition to add another full-time person. Rose is going to be out there pounding the pavement, making sure people are aware of our services, and Jen will be here in the office processing those applications as quickly as she can. So if you have clients that you work with, please send them our way if you have any questions on if they need health insurance or not. And then we're also able to refer, to your organizations as well, for clients that we're working with that may need services other, than what we can offer. So I think it's just really important that we all continue to work together and use each other as a referral source. So again, thank you for all your work with the coalition.
Thank you. Rose?
Good morning, everyone. I would like to just take a few minutes and talk about the youth component of the tobacco cessation, which is Voice. Voice is an Indiana statewide youth empowerment brand whose initiative is to engage, educate, and empower teens ages 13 to 18 to celebrate a tobacco-free lifestyle. We will accomplish these objectives by developing and fostering partnerships with school districts and other youth-serving organizations in LaPorte County to carry out the mission of Voice. Facilitate opportunities for community groups to collaborate directly with teens who are interested in engaging in grassroots directly with teens who are interested in grassroots organized activities that lead tobacco-free lifestyles. We will also create an action plan, an action squad, which is a core group of teens, 5 to 10 teenagers that will be recruited, and they will meet twice monthly to strategize, plan, and implement the yearly Day of Action events, work as a team to develop a plan to introduce voice and advocacy for our local and our state politicians for change. So I am definitely looking for organizations that have a passion around tobacco. And if you have any young people that you're working with, please refer them to me so that we can definitely get them involved. I also put my email address in the chat box as well. And if you have any other questions, please reach out to me. I will be more than glad to answer those questions for you. Thank you.
Thank you. All right, so now I will start calling on the rest of you all. Pull up the list here. Catherine Heeb.
Hello, I'm Catherine Heavy. I'm the director of the Woodland Cancer Center here in Michigan City. So smoking cessation and everything that you guys are all about is, what we're trying to help our patients work through. So I really appreciate all that you guys have as far as resources. I know that my colleague Kelly, who you will be on here shortly, we're working to develop an Aspire program here at Franciscan so we can help support the community in smoking cessation. So more to come when that kind of gets a little bit further along in development. So
Great, thank you. Chantel Johnson.
Hi, good morning. I was getting off of mute. I'm Chantel Johnson, and I am the Community Relations Consultant with Anthem Blue Cross and Blue Shield, and we're one of the MCEs for the state Medicaid program. I'm happy to be here and see some familiar faces. Hi, Doris. It's great to see you. I just wanted to report out I am super excited. Anthem has partnered with Edgewater Health in Gary to promote a Living on Purpose mental health and awareness and suicide prevention program. And it's going to be at Michigan City High School in October, where it's focused on the mental health component, and it's going to bring students together who experience challenges, distress, or trauma in their lives. And the guest speaker is Dominique Miller, who is a NFL football player, and he will address the students in a rally. So I just wanted to let you guys know that we will be focusing on a mental health and suicide prevention component with the Michigan City area schools. And as soon as things are ironed out, more to come, I will share with the group. And thank you.
That sounds amazing. Thank you so much for sharing that.
Sure.
Ebony Neal.
Morning, I'm Ebony Neal, the Family Resource Specialist for the Healthy Families Program at Doombrook. We at Doombrook, we don't have many updates. The Healthy Families Program, we are slowly trying to get back and start doing home visits in person, but we are still offering everything virtually for families. And for those of you that do not know or are unfamiliar with the Healthy Families Program, we just service moms who are expecting or have a child under 3 months, but we service or offer our services to those families up to 5 years of age. So if you know of any expecting moms or moms that have new babies that just need a little support, you can have them outreach us. Also at assessments, we give away free pack and plays, and that's whether moms decide to join services or not. And then if you guys have any free time, you're always welcome to check out our Doombrook Facebook page. We have the Tuesdays at 10s where we also spotlight other organizations and what they're doing in the community, as well as any updates that we have for Doombrook.
That's great. Thank you so much. Let's see. F. Jackson.
Brett Jackson.
Nice to meet you.
Nice meeting you as well. With the Indiana Commission for Higher Education with the 21st Century Scholars Program. And don't have much update, but those of you who don't know, or just to be refreshed about the 21st Century Scholars Program, it's a program for low-income families for their kids who are in the 7th and 8th grade that can enroll. And if they qualify, the state will pay 4 years of college tuition. They will have to graduate from high school with a 2.5 GPA. We have 12 SSP requirements that they will have to complete by their senior year. And if they complete and follow the pledge, the state of Indiana will pay for 4 years of college tuition. And so I cover the entire region. That's 10 counties, 120 schools. And so I'm out hitting the pavement and to get kids to pursue their dreams.
That's awesome. Thank you so much. Hannah Melka.
Our only new update right now is we are doing HIV screenings at our clinic on June 21st. Those will be from 7 a.m. to 5 p.m. So if you know anybody that would be interested in that, you can send them my way, send them my email.
Great, thank you. Becky Simmons.
Sorry, I don't have an update. Thanks.
No problem. I see. Jennifer Heath.
Hello, everyone. Not a whole lot of updates from Swanson Center right now, other than we are starting to see people in person, as well as still offering virtual visits. If anyone has any interest or anyone who needs help with their mental health needs and they're in LaPorte County, have them give us a call. We can do a same day intake and get them started on services as quickly as possible. Again, if anyone has any questions, just get in touch and let me know. Thanks.
Thank you. Jessica Bamber.
Hi, I'm Jessica Bamber with Caregiver Homes. We are a provider of structured family caregiving. So we essentially support caregivers that are taking care of a loved one aged and disabled in the home, and then we pay them a stipend. And no other updates.
Thank you, Jessica. Jody Bono.
Hi, I'm Jody Bono. I'm the On My Way Pre-K project manager for LaPorte, Porter, Lake, Newton, Jasper, and Benton. On My Way Pre-K is a grant where families can apply where their child would be able to attend pre-K at a provider for the full school year before they would attend kindergarten. Normally families might be on like the CCDF wait list, and it would prioritize those 4-year-olds to come off first. This year they actually have one for families that would be on like SSI or SSDI. There's limited funds throughout the state, but those children would have the opportunity to apply as well to get services. So I might put all of my contact information in the chat box as well. And that is a statewide program.
Great, thank you. Camila.
Sorry, I'm trying to get my video on.
No problem.
Okay, hi, I'm Camilla Richmond. I am the health manager here at Head Start. And here at Head Start at LaPorte County, we service kids 3 to 5 for schooling. So no updates other than we are accepting applications online at paladin.care under Head Start for children for the fall for schooling. It is in person. And I'm thinking August, I'm trying to have a health fair prior to the students coming in to where I do like screenings and things like that so I can get their health requirements in. So maybe I can partner with some of you guys and you can set up a table and things like that when parents are coming in to have that conversation. You need to have a conversation because I know we do have a lot of parents that, you know, may need help with insurance and things like that. So
that would be great. Thank you. Kathleen Daly Klein.
Yeah, I was almost confused as to who you were talking to because I'm somehow signed in as one of my managers.
I'll change your name.
Thank you. I'm Tamika Saunders with United Healthcare Community Plan. We do offer, well, we're a new Medicaid option for Hoosier Care Connect, age blind, disabled, Hoosier Care, foster care community and wards of the state populations. Sorry, I lost my train of thought when when you said Kathleen. We're kind of focused right now on open enrollment since it's when we're a new option and it's going through the end of August. So that's our target for now.
Awesome. Thank you, Tamika. Kathy Walker.
Hi, I'm with Indiana Rural Health Association, specific program connecting kids to coverage. I did put some information in the chat. We are a partner with Covering Kids and Families, and we're just here to fill gaps. We are statewide and 100% virtual. So I'm here to assist in any way I can with insurance enrollments. And our focus is on children, but that also means families, and we also do the marketplace. So we're just another option. So I'm glad to work with any of you if needed. Thanks.
Thank you. Kelly Oliver.
Hello, Kelly Oliver here. I'm the Lung Nurse Navigator and Aspire Program Coordinator with Franciscan Health Michigan City. And I am located at the Woodland Cancer Care Center. And as Kathy Hebby said earlier, we are working to get our Aspire program up and running. So it's not in working order yet, but we will update when it is. And that's it for me.
Awesome. Thank you, Kelly. Lacey Pullman.
Hello, Lacey Pullman. I'm with Early Learning Connections through Geminis. I'm the Community Engagement Specialist for our Western counties. Right now, we have our Build, Learn, Grow scholarship going on. I know, Melina, I believe I did send that to you, some information. So if anybody is interested in that, let me know. I can send that information again.
Great, thank you. Naziha.
Hi, my name is Naziha Ibrahim. I'm a case manager at Futures Case Management. For the, well, I do both sides, the aging and disabled side, the traumatic brain injury, and also for the CIH waiver and the family support waiver. At this time, there's no updates on our end.
Thank you. Shirley Dubois.
Good morning. Let me move to the other screen. I'm Shirley Dubois, and I am the North Region Director for Tobacco Prevention and Cessation, Indiana State Department of Health.
So I report to Shirley a lot with all of my activities that I do for tobacco prevention and cessation. So thank you for being here, Shirley.
Yes, ma'am.
Let's see. Tay Leftridge.
Hi, everybody. I'm Tay Leftridge. I am from Artemis for Women. I am the certified community healthcare worker here. And my primary goal is to work with pregnant women, high-risk women, and their children. And so I want to apologize. I have been hoarse all morning. So hopefully my voice doesn't get on your nerves today during the presentation.
No worries. Thank you for being here. And I will get you up and running in just a second. I want to make sure I didn't miss anybody. I see some phone numbers listed as well. Is there anybody I missed?
Hi, everybody. This is Doris Higgins. I'm sorry if you called on.
Oh, I'm sorry, Doris. Go ahead. Uh-oh, I think we're having some audio issues. Doris, if you wouldn't mind just entering your info into the chat if you haven't. Is there anyone else I missed? All right. So thank you so much, everyone, for sharing. We really appreciate all of your updates. I'm happy to see some new faces and names. For the sake of time, we'll just jump right into our guest speaker. So I'd like to introduce Tay Leftridge, who is, as she said, a certified community healthcare liaison at Artemis for Women. And she will be speaking with us today about changing the face of implicit bias. So Tay, you can go ahead and share your screen and we're ready for you.
Okay, can everybody hear me okay?
Yes.
All right. Again, I'm Tay Leftridge. I am from Artemis for Women. And so today we're going to talk about changing the face of implicit bias. So let's start with the definition of what implicit bias really is. And we look at it as an unconscious aversion against a group of people or a person, or a preference towards a person. And so implicit bias can be a positive or a negative thing, depending on the situation and how you're looking at it. But today we're going to talk to you more about the negative side of implicit bias. And it comes from the stereotypes that we have in our society, our experiences. It can come from visual cues just from the time we're children. It most often includes microaggressions, and we talked about microaggressions at the last meeting. and it's universal. So it's something that is happening all across the world. So it's not specific to the United States. And typically it is something that is involuntary in our behaviors and is not something that's controlled by our morale or our conscious decisions. And so as we go further into the presentation, what I really want to focus on, because I am working in healthcare, is the implicit bias that we do see in healthcare. And so in addition to the definition I just gave you, what happens is that the implicit bias actually impedes the access that people need as far as their medical health care, as well as there is a lack of respect for the person that's being served, as well as in a non-inclusive process that happens in their medical treatment plan. So just for a quick moment, I'd like everyone to close their eyes for just a moment so that you can just use your ears instead of your eyes. And we're just going to listen to something really quickly here. Okay, so that was a really quick sound bite, but there were two different heartbeats there. There was the mother's heartbeat and the child's heartbeat. And when you listen to those heartbeats, you don't hear race, you don't hear gender. All you hear are two hearts, two lives that are worth preserving and worth taking care of. However, in our medical system, over 700 women die each year due to pregnancy-related complications, and more so, non-Hispanic Black women are 3 to 4 times more likely to die than their white counterparts when it comes to pregnancy-related complications. And in reference to our infants, 11,300 newborn babies die on the first day that they are born in the United States. And that is the highest death rate in the known industrialized world. And that says a lot about what's going on in our society as a country who is very affluent and has some of the most well-renowned medical facilities here. And when we look at it from a state perspective, the mortality rate is 12.2 women per 100,000 live births, and the children are 6.5 children pass away per 1,000 births, which actually exceeds the national record if you look at the statistics. And so if you think about that from, I like using if-then statements. If Indiana's rate exceeds the nation in infant mortality rates, that means that the statistic we looked at just a few moments ago, where we talked about the nation as a whole, that means we have more babies die here in Indiana than anywhere in the United States, if we look at those statistics and compare them. And we have a responsibility to them all, to protect them all, and to treat them fairly and take care of them. And so when we look at maternal access to care, all of the red that you see here is places where we call maternity deserts. These are places that either do not have any access to care or very minute access to care. And the orange, the two different color oranges are level 1, meaning that they can birth babies in those areas, or level 2, they're able to handle babies that need to go into a NIC unit. And so when you look at this map and see this sea of color and how much is not presented, and that has nothing to do with race, but if you look at where the areas are, these are typically places where there are Black, brown, or even indigenous people that live in those areas. And so we do have issues that we need to address in our medical system. Now, when we bring that closer to home and we look in the northern region, which is where LaPorte is located, over 52% of African American women do not receive prenatal care as of 2019 statistics. That's over half of the women that become pregnant in this area that are not receiving care until late in their pregnancy, and sometimes at that point it's too late, and that is affecting the excuse me, the rate at which these babies are not receiving adequate care. So it's time for us to take action, and we know that implicit bias and structural racism affect how women of color are treated in the healthcare system. And there are things that we can do amongst ourselves and in our communities to start to hone in on the problems and try to change and fix the way that we do things. Intervention and prevention. Guess I shouldn't talk with my hands. Intervention and prevention, listening, responding, and advocating for those women who need the services. Here at Artemis for Women, we, as part of our fight, we have started to do a questionnaire where we ask women certain questions. We look at social determinants of health, and we find out how we can adequately meet their needs for a positive outcome of both mom and baby successfully making it through pregnancy up to a year after their birth. Also doing education and implementing training within your facilities on implicit bias and racism, and also having some accountability measures in place that will help to decrease the incidences of bias and racism within your organization. And the bottom line is that we want quality, equitable health care for all women, but especially those women of color who are not getting that adequate care because it is an essential human right. So behind all of that data are all kinds of experiences. And the one thing that I wanted to, there are 24 of us on this call today, and 2 out of 3 clinicians were found to harbor implicit bias in Blacks and Latinos across the nation. So if we just took our small group and used it as if we were the clinicians, that means that 15 of us out of this group at some point in time during the time we're treating these people did not treat them fairly because of our bias towards them. And that's pretty scary, to say the least. And I won't read through all of these, but the one in the red just really hit home for me because our children are not being treated as children at all, or not being given the same compassion and level of care that is needed. And it could be something as simple as what it says here with a topical anesthetic or pain medicine for whatever they came in for. But we're seeing that all across our nation, and there are so many statistics that back that information up. And also that implicit bias is so ingrained into our society that it's almost like the air we breathe, as one person reflected. And a lot of these stories are coming from either people that have experienced bias or workers that were in a facility and did research and took note from their staff. So knowing that a lot of our things come from our stereotypes and our surroundings, what we need to do is go back to the basics. And I love using this this chart because it comes from Maslow, who talks about our hierarchy of needs, the basic needs that we need in order to survive as a human being. And when you look at where the medical facility or medical community comes in, I want to highlight safety, because most people who have experienced implicit bias or racism during their time in a medical facility do not feel safe. They do not feel that they will receive treatment without judgment. And so they feel like they can't rely on medical staff, which makes them either one, not have the medical treatment that they need, they just don't show up, or two, they go knowing that they may not receive the care that they are supposed to have and just take whatever they can get. And that's not really where we want to be. And so the CDC also recognizes that, and they have started a campaign called Hear Her. And you can actually go to the CDC website and see that there's a series of videos that they have put together in order to, sort of like PSAs, in order to try and reprogram, so to speak, the way that we see each other. And from the Hippocratic Oath, which is taken by medical professionals to do no harm, if we are showing bias and we're not treating people as we should, isn't that doing harm? So a lot of people ask, what can I do? How can I change it? Well, 2020 taught us a lot. And so we saw things on television that hurt our feelings. We saw the way that people responded to what was going on. And we learned that the bias that we see is so prevalent in our society, and we didn't want to admit it, but we have to, because, and you can see from the memes that I was able to just pull up on the internet, it's everywhere. It's in everything that we do. And it's just become such a normalcy that we have to start to really think about it. So no longer can we say, I didn't know. In the age of communication, in the age of information, with the internet, with all the literature that's out here, with all the studies that have been done, we can no longer say, I didn't know. And so the first thing that you can do is to recognize when someone points out to you that something you said or something you did was not correct or did hurt their feelings, and not get offensive, but open the conversation to understand how you can change your mindset or see from their point of view. Another way that you can get involved is legislation, as well as organizations that are out here. Mom Nimbus is an act that is currently in our House of Representatives. It is focusing on women of color and their lack of care in the medical community, and trying to get a legislation in place so that we can empower these women to get the care that they need. And these other organizations are all great organizations that you can find both research and information on. A lot of them have newsletters that you can be a part of and learn from them as well. So changing the way we think and revising, I call it revision therapy, because it really is a sort of like a therapy. You have to, you know, sit down and talk it out, think it out, go through the process, find out where you can make changes. And so as part of your organizations, one of the things that you can do is look at your policies. Does your policy promote or acknowledge that there are inequalities? Are they highlighting any of the research gaps? Excuse me. Does your policy include input from your patients or the people that you see that are being affected by bias in racial situations? Who's missing from that conversation that can put in to help to make that policy better for everyone? I like to watch medical shows, and so New Amsterdam is one of my favorite shows right now, and I don't know if you guys have heard of it, but if you have Hulu, binge watch the show. But season 3, episode 8 talks about implicit bias in the medical community, and it actually highlights some of the things that go on in our medical facilities that prevent women from care. And in one case, there was a woman who couldn't have a surgery because she was Black, because the scale that they have to evaluate who can do certain things would not allow her to do it. And so if you have the opportunity, I do recommend you go and see that one. Also, when you're looking at our history and how we have amendments in our Constitution, there's nothing wrong with amending the way that we do things in our organizations. So looking at what context the policy was made under at the time that it was made. You know, was it made in the 1960s? Was it made in the 80s? When was it made? Does it propagate racial and ethnic disparities? Does it continue to cause that cycle to turn over? Is it inclusive? And that includes our LGBT community as well. And you know, who can you talk to about making these changes? If it's in your administration, if it's something you see from a state level, are you talking to your legislative representatives? And are there services that you can put together in order to bridge the gaps? Harvard University did a study where they have a whole list of tests that you can go and take on implicit bias. And like I said, implicit bias is not just about race. It's about gender. It's about weight. It's about even among the African-American community, skin tone, light skin versus dark skin. There's so many different ways that you can be biased. And so start here, take these tests and see where you fall on that scale. That's another way that you can start with yourself. Start with your organization, have your people in your organization take the test, and then come together and discuss how you felt about the test, you know, how you think that you can make changes within your organization. There are so many different ways that these tests can be used. But one thing I wanted to point out was one person took the test and said their hands were literally frozen when they had to associate good with a Black person, which I think is crazy, but there are people out there that have that problem. And so they thought the test was trivial and that something was wrong with it. But after going through the test and continuing through, they realized that something would actually have to get them to change or reevaluate their own mindset and not the test itself. So here are 3 books that you can pick up that Two of them I've read, one is on my list. Here in Valpo, we have a group that's actually called, there we go. We have a group here that was actually called White Fragility, and they came together. It was actually organized by an older group of white residents here in town, and they started to have the conversation about why it's so hard to even have a conversation about racism and bias among the different ethnicities. Why are all Black kids sitting together in the cafeteria? Someone actually handed me this book in college, and I looked at them and said, I'm Black, I don't need to read this book, and threw it back at them. But I did sit down and read this book, and the conversations that are had in here are so amazing, and it really does make you open your eyes and think about things a little bit different. And if you're in the medical community, Just Medicine is one that you can read that addresses the racial inequalities here in our country. So as we bring this to a close, one of the things that I want to remind you of is that telling our stories is a big part of who we are as people. And so the stories that we tell are ways that we teach each other. We actually get most of our knowledge from stories and not from necessarily reading something. And it's in every culture, every religion. And so it's ingrained in the way that we live our lives. And so changing the face of bias also means changing the stories that you tell, and telling stories that will help people to see what's going on out there in the world. So there are two stories I want to tell real quickly. The first woman had a normal pregnancy and had some complications during her labor and ended up having to have an emergency C-section. So during her recovery, she began to complain about chest pain and shortness of breath, but she was ignored. And so she kept insisting because she knew her health concerns, she knew her health history. And ultimately, they found blood clots in her lungs, and she ended up having other complications that went on, which kept her in the hospital for an extended time. And you all know this woman or have seen her, and that is Serena Williams. And so bias has no filter when it comes to who you are or how well known you are. And so just looking at her story and the things that happened during her time, if she had not been an advocate for herself, things could have turned out quite different. So this final story, I'm just going to read through this really quickly. I'm 21, 7 months pregnant. I was vomiting all over the place and couldn't keep anything down for hours. My abdomen is cramping. It's the middle of the night. I'm in tears and in a panic. This is my first baby. I am clueless as to what's going on. My husband took me to the no insurance hospital. I was taken to the labor and delivery floor. The nurses were forcing me to drink fluids, but as soon as I drank them, it came right back up. And this went on for several hours. There was so much vomit, the room reeked. I was never offered IV fluids to help combat dehydration. And after being left in an exam room for hours without any answers of medical attention, a nurse comes in and starts a procedure down there without really explaining what's going on. I jumped and screeched at how aggressive she was working and responded, if that hurt, and she responded, excuse me, if that hurt, then you're going to have trouble having a baby, very angrily. Shortly after the incident, my husband demanded I be released and felt the staff was not interested in truly caring for me and would therefore take me somewhere else. Instead, he took me home. This is my story. And I actually have several more that happened after that. So I know and have experienced what it's like to be on that side of not being treated fairly and not given the adequate care that is needed. And so, again, couple things that you can do: educate yourself, look at the policies that go on within your organization, talk to people, keep the lines of communication open. And I think that if we start with just those things, that they will take us a long way to building a better way of medical care here in our society. I thank you for your time. If you have questions, I'd be more than happy to answer those.
Hey, I cannot thank you enough for this extremely informative and moving presentation. And thank you for giving us practical ways that we can start working on our own implicit bias and giving us a bunch of great resources that we can start utilizing. I really appreciate it. Are there any questions for Tay?
I do. So Tay, one, thank you for sharing your story. That just breaks my heart. Was that your beautiful, all of your children that we saw on the screen in the picture?
Oh, you're on mute, Tay.
Yes, this is my entire family. I have 3 children of my own, and the 2 sitting in the chair in the front are I call them my bonus children. So they came along with my husband. But this is my family and my grandchildren. Yeah.
Beautiful family. But I don't know if it's a question or just a comment. During our tobacco grant and working with some other organizations that are family focused, pregnancy focused, we found that in LaPorte County, the number of females that smoke during pregnancy is a little over 19%.
Yeah.
And the state average is 16%. When you look at the whole state is 16 and just LaPorte County is, at 19%. I'm wondering if and so that's leading to, I'm sure, a lot of the infant mortality, low birth rate, issues that you kind of referenced in your presentation.
Definitely. And it's funny because as Melina was talking earlier, I started writing some notes over here saying, I need to talk to Melina. We need a program or something, a community action towards smoking cessation among pregnant women, because it is an issue. And when I talk to women, because they do get referred to me if they are pregnant and smoking. And when I talk to women and I talk to them about ceasing, a lot of them just don't see the need to stop. And so it's a sad situation, but I think that it also has a lot to do with the way that the media has portrayed smoking as being safe.
I agree. And actually, and I'll contact you offline about this. And Melina's not even aware of this, but I do have a meeting next week with an agency that is really looking to partner and collaborate on this very topic about, making females aware about the risks for smoking during pregnancy. And there is a special, I believe, state cessation program for pregnant women. So I'll touch base offline with you about that, Tay.
Thank you.
Thank you.
Again, thank you so much, Tay. In closing, I just want to say a few reminders and action items. I will be sending out that survey to gauge your interest in either of those coalitions I mentioned earlier. And so please fill that out. And also email me with any July newsletter submissions that you'd like to enter by June 29th. That's everything I have. Again, thank you, Tay. And our next meeting is Wednesday, July 14th, and I hope to see you all there. Thank you guys so much for being here.